Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Bacterial vaginosis. In bacterial vaginosis, the normal bacteria in the vagina is Doderline bacillus or lactobacillus. This Doderline bacillus or lactobacillus is replaced by Gardnerella, Mycoplasma, Ureaplasma, Peptostreptococcus or Mobilincus in bacterial vaginosis. Gardnerella is most important. There is no inflammation seen in bacterial vaginosis. Chief complaints: the patient presents with foul smelling discharge with no pruritus, no dysuria, and no dyspareunia. Discharge is off white or grey in color with foul smelling profuse discharge where pH is more than 4.5. There is no sexual transmission, so treatment of partner is not done. Investigation of choice for bacterial vaginosis is saline microscopy. Clue cells are seen on saline microscopy in bacterial vaginosis. Vaginal epithelial cells to which the bacterial cells adhered are called as clue cells. On pap smear, you can see clue cells. Gold standard examination, that is on gram staining, you will do Nugent stain. Nugent score is 7 to 10. It is seen in bacterial vaginosis. This Nugent score is done only if the diagnosis cannot be done clinically or if it is not done on saline microscopy. The whiff test is done in bacterial vaginosis. In bacterial vaginosis, we will add 10% of potassium hydroxide is added to the discharge. And this, once it is added to the discharge, it gives fishy odor. So, in bacterial vaginosis, will show whiff test. There is Amsel's criteria. In Amsel's criteria, if any three of the four, out of the four criteria are present, then it can be diagnosed as bacterial vaginosis. 1. Off white or grey colored discharge. 2. If pH is more than 4.5. 3. Clue cells are more than 20% of entire cells. 4. Add KOH, 10% KOH, and it will show fishy odor. Then whiff test is positive. Then treatment. In treatment is you will give metronidazole 500 milligrams BD for 7 days or clindamycin 300 milligrams BD is given for 7 days. Even in pregnancy, you can give the same treatment. Back
thank you and thank you for watching.